Hello, thanks for joining us. I'm Doug Hogan, Communications Director here at the Cabinet for Health and Family Services. And I'm joined tonight by Dr. Jeffrey Howard, who is the Acting Commissioner in our Department for Public Health, and also Dr. Jonathan Ballard, who is our State Epidemiologist. And we want to spend some time talking about the flu. Obviously, we now have a flu epidemic in Kentucky. It is a serious situation. And so we thought it would be a good idea to go straight to you here on Facebook and give you some information. We want to talk about ways you can protect you and your family. Also, we want to talk about what to do if we have the flu or we think we might have the flu. And then we have a lot of questions to get to as well. So we'll be funneling through those as well. There's also the availability if you are in the deaf or hearing impaired population. If you want to go and see this on a live captioning event, you can do that. The address for the URL is on the bottom of the screen, and you can go there and see that in its entirety for a live captioning. We also want everybody to know, even though you guys are doctors, this is not medical advice from a physician. This is for general discussion purposes. So we just want to make sure that everyone is aware of that. Let's start, gentlemen, because we have 65 deaths and 3 of those pediatric cases. We also have a number of people who were otherwise healthy who have died from the flu, and we're now saying it's an epidemic. So what does that mean exactly when you say the word epidemic? What should the public think of when you hear that word?
Well, thank you, Doug, for introducing us. Let me thank all of you guys who are viewing today, coming in to learn and hear about and contribute questions to this very important epidemic that our state is facing. We are very excited. Dr. Ballard and I have been excited to talk to you guys about this issue. To address Doug's question, what is an epidemic? What that means is that this disease, the flu in this case, is occurring at a rate that's greater than typically what we expect for this particular disease over a specified period of time. What that means to the general citizen of Kentucky is that when you go out on your daily routines, you're shopping, you're going to school if that's what you do, you may be exposed to people with this virus. So you should take routine and general precautions. And Doug, I'm sure we'll be talking about those precautions later on.
And there's lots of questions about the flu shot and the
Sure.
vaccine. We'll jump into that right off the top because in our Facebook questions that we pose and our Facebook posts, lots of questions about, do you know the numbers of the people who have the flu? Did they receive the vaccine or not? Only 10% effectiveness is what we're hearing a lot. Can you just talk about all those issues involved with the flu vaccine?
Those are great questions that the audience members on Facebook have asked us. And it is still our opinion that the vaccine is effective, and we encourage everyone age 6 months and greater to get the vaccine, especially those who have risk factors for complications of the flu, being the older people and the younger people. The vaccine, that 10% number you referenced, it comes from some studies out of Australia. Australia experiences the flu season in their winter, which was during our summer, back when because they're in the southern hemisphere. Mm-hmm. And they determined that the flu vaccine, specifically for the H3N2 strain, which is influenza type A virus, that it was 10% effective. Now, the CDC has held a call with us a couple of weeks ago across the United States and says that, no, it's much more effective than that in the United States. And they said it's more like where it was last year, which was about 40% effectiveness overall. And so, greater than 1 out of 3 people would be protected from the flu if they were able to get the vaccine and then were to come in contact with someone with the flu and be exposed. So overall, it's still it's the best means other than personal protection otherwise, with washing your hands and covering your mouth and removing yourself from people who have the flu if possible. The vaccine is still one of the best ways to protect yourself and others, your loved ones, children who may be less than 6 months of age who cannot get the vaccine. The best thing you can do is to get a vaccine yourself.
And the safety of the vaccine?
The vaccine is generally very safe. The only people who need to be concerned are people with specific allergies, particularly egg allergies. Dr. Ballard, who is a practicing family doctor, can talk a little bit about precautions that folks who may be concerned might take.
Sure. Well, the vaccine, Dr. Howard, is overall very safe. Very few complications of the vaccine itself. The vaccine may cause some body aches, some chills for a brief amount of time after having the vaccine, but nothing like the flu. And some people sometimes kind of compare those feelings with the flu, but nothing like the flu itself. People who get the flu oftentimes describe themselves of being hit by a truck. It really, the flu itself can be for most people, a condition that they will get over after a few days, but can be a very serious condition, as we've seen with those deaths and the complications that people are having.
Doug, let me interject something here. The flu vaccine is particularly effective against influenza type B strains.
Yes.
What we're seeing early in the season is typically influenza type A, of which the H3N2 type is a part of. So I expect that the vaccine will be more effective later in the season,
Absolutely.
which is the reason it's important to still get vaccinated. The good news is there's plenty of vaccines still out there.
And Dr. Howard, to add to that, it's also been shown to be very effective towards the type A flu, that's H1N1. If anybody remembers, that was the type of strain of flu that hit in 2009 that caused deaths across the country. And subsequent to that, that strain has been added into the vaccine as well. We do see cases of H1N1, but the vaccine is very effective for preventing H1N1. That's partly why you don't see those numbers this year, in my opinion.
And generally, the flu season in Kentucky does last until mid-May or so. Usually, though, I listened to Dr. Howard do an interview with a local journalist just the other day, and I think you said typically we may have reached the peak by this time normally. That's not the case this year. Can we talk a little bit about that? Because there are some reports out there that the flu is peaking, so we are at epidemic stage. Is that accurate or not?
You know, I'm not, and Dr. Ballard and I will have this discussion.
Yeah.
And as those of us who are interested in epidemiology, like Dr. Ballard and I both are, we'll debate this a little bit. But I do not think we are peaking quite yet. I'm thinking we will peak probably more in the next month or so. But I'll be open to hearing your comments about that. Dr.
I'm in agreement with you. It's hard to say, I mean, because the flu vaccine is spreading at this current time. It started earlier than usual. We had a very early season of flu this year, and it's hit hard. And we hope it doesn't go worse. We hope that all these efforts and the efforts of the public to getting vaccinated and protecting yourself and doing all those precautions that is becoming aware in the community will help keep the peak being now. That's my hope, that it is peaked, but we don't know that for certain. If you want to compare where we're at in our flu season today compared to how it was last year, I have some numbers on that.
Okay, sure.
So at this point in time last year, we had 4 deaths, 0 pediatrics, so no child deaths at this point in time last year, and we had 5 long-term nursing facilities that had outbreaks. Outbreaks that happen every year in nursing facilities, and we do see that as part of the spread of flu. And comparing that to now, we had at this time, we have over 58 outbreaks in nursing facilities and 3 pediatric deaths. So that's just a point-to-point comparison, and so I think it just shows that we've had more flu activity early in the season when we have a lot more weeks to go.
You know, Doug, when the H3N2 type is prevalent, we tend to have worse flu season. That's expected. This occurred back in 2014 to 2015, and the good news is our flu season so far hasn't been that bad.
That's true.
Okay. I have a question from Bridget Bissett, and she asked, are people dying because the virus progresses so rapidly? Would early diagnosis and treatment lessen the chances of it being fatal in otherwise healthy adults?
Yes, I believe so. The CDC has issued a health advisory that states that people with the flu who have complications, who have risk factors, who are hospitalized, are recommended to be treated with antiviral medications. And it has been shown the earlier that you start that treatment, the better. But in the previous years, they've always said you need to be treated in the first 2 days of the illness to have benefit. But they're saying that now that's not necessarily true. We're seeing benefits of reducing complications from the flu if you start treatment later on. And that's an advisory that went out to the healthcare professionals across the country.
What about Tamiflu and other medications? What's your take there? Because that has spawned some questions as well, with some people saying that they take Tamiflu all the time, or at least more than just if they think they have the flu. What about Tamiflu and over-the-counter medications?
Well, Tamiflu is one of the types of medications that has been shown to be effective for reducing the length of time that the infection happens and also reducing the complications that happens.
So Doug, Tamiflu is a drug called oseltamivir. It's a neuraminidase inhibitor. That's a drug
that prevents the flu virus after it's infected our cells and hijacked that cell's machinery from budding from our cells and being able to spread. And what is unique about the point Dr. Ballard is making about the CDC's recommendation, this is the first year that I know of that the CDC has recommended those drugs outside the 24 to 48 hour window. For our providers out there that are listening, if you have folks with the flu, you want to get them this medication early on because it can prevent the progression of this disease.
We have a question from Ingrid Jordan who says, I read that our immune systems can actually over-respond when attacking this particular strain of the flu. Is it a good idea to take extra vitamins like vitamin D or vitamin C when you're dealing with this?
Well, it's important to know why some people develop complications and why some people do not. Those with weak immune systems, that happens with the aging process, are more vulnerable to complications such as bloodstream infections or pneumonia and death that are complicated by that. Many of the pediatric deaths are related to the same thing because some pediatric cases across the country it attacks those who are more vulnerable, who have chronic disease even at a pediatric age. Now, taking as far as any particular supplement or vitamin D or vitamin C, I'm not aware of any evidence that will protect you from the flu or the complications of it. But being a healthy overall and having a strong immune system does.
Let's talk about closing schools and staying home from work and being excused from work, those sorts of things, because that also generated a lot of discussion. And people are saying if we have an epidemic and we want to keep people out of large crowds, then let's take precautions like that.
So, Doug, when we're talking about epidemic, like I explained earlier, we're talking about the disease is just more prevalent. We're not at a point that we need to close schools or do anything like that, but what we do need is folks to understand that the disease is very common this year and that they should take general precautions. So those general precautions include washing your hands frequently, sanitizing high-touch areas, so your computer screens, our cell phones, phones at home, remotes, doorknobs. That's what's important at this time, and that's the reason we felt it was important to make that point when we called this an epidemic.
And Dr. Howard, the flu season, as you're fully aware, is expected to last through May. I think the official last day of the flu season this year is May 20th, set by the CDC. And, that's the rest of the school system for many districts. So we have good evidence of what one can do to protect themselves and to prevent the spread of flu. Practicing good hand hygiene as well as using tissue properly and disposing of that tissue, washing your hands very frequently. It's been shown in a recent study that the flu can spread through exhaling and talking when you have an active case of the flu. So that means excluding yourself when you do have the flu.
Stay home if you're sick.
Stay home if you're sick. Now, that's important actually though for schools, employers, because if you have the flu to spread more, that's going to cost business more. It's going to cause more children to be absent from school. So the best evidence and the best guidance that we can have is if you are sick, stay home, protect others. But if you're not sick, engage in your employment, engage in your school,
Absolutely.
and protect yourself.
If you're sick, stay home.
Right.
Don't tough it out. Don't be a hero. Stay home.
Especially not with this particular strain of the virus.
Exactly.
Misty Maxey wrote in this afternoon, and she says she's a DCBS worker, and every office should be equipped with masks and hand sanitizers. Now, DCBS is our Department for Community-Based Services here in the Cabinet, and that is an excellent question or a comment, Misty. She says lobbies are full of folks, elderly clients, young clients, children, families. Some are sick, some are not. So she would like hand sanitizer in all those lobbies and precautionary measures like that. And Misty, I can tell you, when I saw your comment, I went over and talked with Secretary Glisson, who's the Cabinet Secretary, and also Commissioner Johnson at DCBS. And we're going to make sure that we have a mechanism in place where you can get those hand sanitizers. Most of our offices do have hand sanitizers on the wall, so you can do that. But we want to make sure that you can get those, and in fact, the leadership in DCBS will be offering some guidance to the local counties on that, I believe, tomorrow. I have a question from Mark who says, what can someone with the flu do to keep from spreading the flu? We've kind of talked about that already, but should you wear a mask at Walmart or Kroger or the drugstore? Should you go to those extremes?
If you personally have the flu and you have to be out, I would recommend a mask to protect others. That's an example. So if you are sick and you need to see your healthcare provider, and you're entering the healthcare facility, most outpatient practices have masks available for you to cover your mouth right at check-in. And that's something that the hospitals around Kentucky have made a point to do with their family medicine, other practices. If you're worried in general and you're healthy about others, I wouldn't think so, that you need to wear a mask unless you have some type of immune deficiency. But that every individual person, I think, should consult their own healthcare professional and ask their own individual situation whether that would be recommended or not.
And you may want to fall back, Dr. Ballard, to that same answer for this question. But Angie writes, her husband's on chemo and taking steroids to boost his system. So how long after being off steroids is it safe for him to have a flu shot? Is that a case-by-case issue?
That's a case-by-case issue. I would refer him to both his family care doctor as well as his oncologist, because they will know what medications he's on, how long he's been on them, as well as his most recent laboratory test. Would you agree, Dr. Ballard?
Yes, anybody who has a deep immune system that may be weakened, I think should definitely talk to their healthcare provider about what's best for them.
But what we can say for sure is he needs to be taking much higher precautions than the average person.
Exactly. Mandy writes about vitamin C and vitamin D versus Tamiflu. And again, just what are your thoughts there, or at least taking vitamins C, C and D in addition to Tamiflu, or just in general?
Let me make a clarification, Doug, because I saw this on many of the pre-submitted questions. I think some of the folks out there are thinking Theraflu and Tamiflu are the same thing. Theraflu is an over-the-counter medication that is not an antiviral medication like Tamiflu is.
Yeah. So Tamiflu is a medication that's prescribed. You get it filled at the pharmacy, that type of thing.
Yep, that's correct. And that is the drug that the CDC has made the recommendation on.
Yes.
Okay. I have a comment here about the hand sanitizers and actually promoting the virus mutations in the long run. Teach kids to wash hands and use hand sanitizers as a last resort. Also very bad results for most of those hand sanitizers. So maybe it's not for everyone.
There's some evidence to that. It's recommended if you have access to soap and water that you wash your hands with soap and water vigorously and dry them. But if you do not have access to that, then say hand sanitizer.
Jessica Zupanik has a question that a lot of people probably want the answer to, and that's very simply, how long does it generally hang on when you're talking about the flu? What's the duration of the flu?
So this can vary, and I'll ask Dr. Ballard to weigh in too. I would say for the average well person, it should last up between 48 hours to 7 days. And that is the average person. Yeah. But some people can have symptoms that last much longer, Doug. And Dr. Ballard, who's treated many of these patients, can comment.
That's true. I mean, the majority of healthy adults will get over the flu, within a week. Some individuals, though, for reasons that we're not certain why, because we do see healthy people who are, struck by the flu in a tough manner, but the majority of people will be over it within a week.
And I think Blake asked a question too. We've kind of touched on this. Can you be contagious before you start showing symptoms of the flu? And how long can you pass the virus along? So talk about those two.
That's a very good question. The answer is yes. You can, but typically most people have symptoms before they are shedding the virus or they're able to spread the virus. But that's very difficult, and I don't think there's a real clear answer out there, Dr. Ballard.
Well, yes, you're correct, Dr. Howard. The people can spread the disease, be infective potentially before they are symptomatic. Symptoms, of course, vary. Most people start with some mild symptoms and develop more severe symptoms. They may not even notice that their mild symptoms are the flu. They may think it's the common cold, and it's very difficult to distinguish early on, or mild cases of the flu. What is the common cold? What are other viruses versus the flu?
What are some characteristics that would make that distinction?
Okay. Well, the characteristics of flu itself we could talk about.
Yeah. Let's start with the characteristics of the flu, and then we'll move into the sort of compared to the common cold, because that's a difficult point. It's difficult for clinicians to be able to tell which one you have based on just on symptoms. That's the reason a test is required a lot of times. So people who have the flu typically come in with a runny nose, sore throat, cough. They may have some very severe muscle aches. Dr. Ballard describes earlier that people feel like they've been hit by a truck. That is typically one of the defining symptoms.
You hear that?
You may have diarrhea. You may have nausea and vomiting. Those symptoms are more common in kids.
And fever.
and fever is the other.
Yeah.
Now, let me tag on to that, Doug, talking about people who are able to spread the disease. Those who are infective to others typically are still in that febrile period. Isn't that correct, Dr. Ballard?
Not in all cases, but yes, you're correct. And some people with the flu won't have any fever at all, and
Absolutely.
that's it.
Are there differences in like babies or young children?
It's very
pediatric
difficult.
cases
It's
versus
very difficult.
adults?
Pediatric cases are really, really hard. This disease typically affects kids younger than 5, and especially younger than 2. Those children are at significant risk. The reason it's difficult in them is because they can't tell you what symptoms they have, and if they are at an age they can talk, they can't describe them very well. So, Dr. Ballard, you want to talk about some points they should be watching out for?
So, as a parents ourselves,
Yeah.
we know our typical behavior of
We're
our
both
children.
Kids, mine are 3 and 2. So
Mine's 2. So,
See, I have 2 only kids. One's 22 and one's 14, so I'm good.
well, and you know the typical behavior of your child. So, things to start looking at then is characteristics that are out of normal for them. So, yes, are they developing all those other signs that you can just look at them? Are they having a runny nose and coughing or any difficulty breathing? But if they just start acting fussy, a little bit more clingy, or tired, sleeping a lot, those are things to start cueing in on. But every person needs to start, assess their own individual child and speak with their healthcare provider.
let me add on some real severe warning symptoms
Yeah.
for parents.
Okay.
So if your kid your child, your baby, isn't eating, that's a concern. If they're not taking the bottle, that's a concern. If they stop making wet diapers, or the rate of wet diapers stop, that could be a sign of dehydration. That could mean they're very ill. If they're crying without tears, that can be a sign that they're very ill. Those kids probably need to be seen in an emergency room at that point.
Or, yes, or at least consult with their healthcare provider.
Certainly.
But emergency room could be an appropriate place.
Sure.
Is there a way to help you, the mom and the baby, to help them not spread the virus to other people they come into contact with? Because obviously, many times you're talking about pediatricians' offices, but there's also daycares. There's Mother's Morning Out. There's lots of church events that you're going to, so on and so forth.
Well, parents in general, you follow the same precautions that you would for an adult. You exclude your child from daycare, and understand how difficult that is. So we encourage employers to really take those considerations into play,
Absolutely.
essentially, when you're looking at your employment practices for employees with children. Children will need to be excluded if they're having active flu, if they're sick, of course.
A couple other points, Doug, is that you shouldn't be kissing your child around the face or mouth. Shouldn't be sharing food and utensils during this time.
That's tough for a lot of parents.
I
It's
admit
second
it. I
nature.
admit it.
Yeah, so, especially at that age.
Yeah.
Pam asks, can someone have the flu even though he or she tests negative?
Yes, in the flu season itself. So there's a few different tests for the flu. There are those rapid tests that are pretty quick in the doctor's office. And there's another rapid test that takes longer, 15, 20 more minutes, that's a little bit more accurate. And then there's something called laboratory confirmed flu cases. Those are a more extensive test called a PCR test that's done in hospital labs and at the Kentucky, at our state lab here in Frankfurt. In a flu season, though, if the rapid tests are positive, it's more of an indication that you do have flu. When it's not flu season and a test is positive or negative, it may not be as certain, but they are. And I want to make a point that might be interested to the public. There are such things called laboratory confirmed flu cases, and that is actually when those specimens are blood specimens or in this case, respiratory droplets usually, that are sent to our state lab. We analyze those and we determine what kind of flu it is. Is this H3N2, H1N1, is it type B flu or one of the strains of that? And then that is actually compiled and sent to the CDC. And that's what's actually used to determine the flu vaccine for the following year. And so I think that's just an interesting thing, that's how we actually determine what's in the flu vaccine.
And those laboratory confirmed cases, those are the numbers that our office in communications works with Department for Public Health, and that's what we send out in the form of news stories and advisories to the news media, and that's typically what they are reporting on is those laboratory confirmed cases. And I think I read something yesterday or the day before, we are north of 2,700 laboratory confirmed cases in the entire state, but maybe in one region we may have that many rapid flu cases.
Oh, absolutely.
So it can be a little confusing as to what those numbers are.
Exactly, and that's an excellent point, Dr. Ballard. The number of flu cases certainly exceeds that number across the whole state. I wouldn't personally venture to guess. Maybe Dr. Ballard's brave enough
Well,
to.
flu is determined to be widespread in all 120 counties of the state. It's every region, every county is reporting influenza. At the CDC, they also monitor. It's called ILI net, influenza-like illness net, and this is where they do sampling of like medications that are being dispensed at pharmacies and other ways that cases are being diagnosed and determined at certain specific sites around the country. And the ILI net is also saying widespread influenza. We're seeing it in all 48 continental states as well.
Okay.
So it's across the country.
I want to say Jim Rivard has a comment. As a deaf individual who is often left out of important informational videos such as this one, I just want to thank CHFS for offering captioning so that I may follow along. And Jim, you are very welcome. I think we have at the bottom of the screen, we can put up again that link in case you're just tuning in. We do have live captioning available. You can go to the link that's on the bottom of the screen there, click on that, and follow along with live captioning. And we're happy to be able to provide that service to the folks this evening. Kathy Freer asked, are there any herbs that will promote or improve your body's immunity?
Well, there are varying degrees of evidence of things that would work or not work, and just from my standpoint of being a family medicine doctor, there's nothing that we would necessarily recommend that would be helpful for preventing the flu or any other condition that would be herbal. Some healthcare providers may have differing opinions on that.
What I would say, Doug, is when we are, as a Department of Public Health, are evaluating evidence and trying to make recommendations and follow recommendations given by the Centers for Disease Control and other organizations, we look at the level of evidence, and that's stratified. And as far as herbs and other sort of specialty non-prescribed medication, non-over-the-counter medications, there isn't anything that's the highest level of evidence for that category.
But there could be some benefit for certain individuals based on their characteristics. Their herb X might work really well for some people, or this vitamin or that vitamin. At least that's their prerogative when they have this.
As a provider, I never necessarily just say that no, that's never going to work for you.
Right.
We just don't have the evidence that is going to work from my level to recommend to anybody.
And there's also no evidence that these things would hurt. So we wouldn't discourage anyone who wants to use them to do that.
At least talk to your healthcare provider anyway about it.
Course,
Make sure, though, you do tell your healthcare provider of any supplements or herbal supplements that you're taking.
Exactly.
And I think
Good
that's
point.
a question that Erica asked is will you recommend any vitamins at all or just prescribed drugs? So I guess you kind of just answered that question in a way. Take them, if it's something that you feel is necessary for yourself, but let your medical provider know.
And they can have complications if you have other conditions or interact with medicines you take. So I do make sure that you talk to your healthcare provider.
For the most part, Doug, at the recommendation of your physician, most people should take a multivitamin. That's a fair set. Most people should. But there's no evidence that's super therapeutic. That means above normal levels of vitamins or minerals are useful against the flu that I know of.
Yeah, I mean, I think if you eat a healthy diet that's rich in all the vitamins that you need, you stay healthy, you get exercise, that means you're going to have a strong immune system.
Exactly.
And then if you practice all those other habits we talked about by washing your hands, covering your mouth, those things, then I think that's the best way that recommendations that I could get for someone.
Let's talk about hydration. And Jason Lewis says, what types of drinks are recommended? Gatorade, Sprite, 7-Up, anything like that? If maybe you're having some of the symptoms of the flu, or even if you're battling the flu.
I think it depends on what your symptoms are. In general, water is the healthiest drink you have, but
and
if you're
generally
dehydrated.
just maintain a normal level of hydration. So typically for most people, that doesn't require any special balance in the makeup of the liquid that they're drinking. So water usually is just fine. Some people prefer to drink Powerades or Gatorades or some sort of flavored drink. If that's okay. Still, we want to make sure though that people are drinking healthy drinks. So you don't want to drink an overly sugary drink. Don't use the flu as an excuse to binge.
Okay.
If somebody's dehydrated, there would be special recommendations to take electrolyte fluids or, there's different ones that
At that point, though, they should be seeing their care provider.
Yes, yes.
Mandy says sugar. Sugar further complicates the immune system. Sugar or no sugar?
Moderation?
Yeah, moderate amounts like we would typically recommend with your routine diet. There's no evidence that I know of for increasing sugar amounts when you may be sick.
No, what would your mother say? I guess they would say, not everybody's mother would say it, but chicken noodle soup and staying home is a good thing.
There's
and you
actually
have to have
some
nutrition.
I saw a study recently. There's actually some benefit from chicken noodle soup. I think it's the steam off of it opening the airways. But
that makes sense.
I saw that study recently and thought it was interesting.
Rebecca Rice says, is this flu airborne?
Yes.
Yes.
Okay. All right. Should people over the age of 65 get a different flu shot? That's a question from Blake Johnson.
Well, that's a tough one.
So there are some variations in the flu shot. Dr. Ballard, do you want to talk about those? Some have 3 viruses, some have 4. As of now, there's no strict recommendation that I know of. Do you know of any?
No, but we probably can follow up on that and maybe put a posting answer to that.
And fatigue, again, is something that Pam Fitzpatrick writes about. Again, that's one of the symptoms, extreme fatigue, I would think, with this strain of the flu. Nonverbal tendencies for your baby, if there's issues like that. We kind of talked about that, but can you expand on the nonverbal? Like if you have a child, I think you said that the toddler or the infant can't tell you what's wrong, but again, some fussiness.
So there can be fussiness. They sometimes don't want to eat or drink because it hurts they have a sore throat and it hurts when they eat or drink. They may be pointing to their ears or tugging at their ears frequently. They may be seeming more lethargic, meaning they're not as responsive or as active as they normally would be. Anything else, Dr. Ballard?
I think that's pretty well it. Especially if you
routine
see
fevers, and like that, you want to be watching fevers. They may have diarrhea, the other symptoms we talked about earlier, but I think that it pretty much exhausts it.
Donna Patton Eads asked a question, and I know the answer to this just because of it happened to one of the folks in my office here in the communication shop. Can you get the flu more than one time if you've already had it?
Unfortunately, yes. Unfortunately, because there's different strains. Just because you're protected against one or you get H3N2 strain, then it doesn't mean you won't get type B later on.
Look, let me make a point on that our viewers may find interesting. How you build immunity to a particular virus. For example, if you get the vaccination, you get part of that virus in your system, and your body mounts an immune response to that. And so your body then will, if it's reintroduced to that virus or those same sort of particles, it will attack and kill them. But, so if you got, let's just use an imaginary number, flu type Z, and your body has an immune response to flu type Z, but if you got infected with flu type X, your body couldn't fight that off because you wouldn't have immunity to that other flu type. I hope that makes sense to our viewers and explains a little bit how the vaccine works and how you could possibly get the flu twice.
That's true.
Orange juice. Back to the drinks for just a second. Beneficial, detrimental?
No, I would recommend people to drink orange juice. Not particularly to fight the flu, but I think it's, especially ones that are not overly sugary, is a good drink to include in your sort of routine diet. But again, at moderation and not above your caloric and sugar intake needs.
Great.
This may be a question with Dr. Ballard with your personal practice.
Okay.
But Erica is asking about concerns with Tamiflu. What's the body of evidence with Tamiflu? Are there any concerns there? Are there
like any
studies?
Sure. Like any medication, every medication for a small number of people can have complications. It's been FDA approved, the medication Tamiflu, and it's a very small complication rate, but yes, there is complications to any medications, and so that's why we say talk to your individual healthcare provider to tell whether or not your risk or your need for it because of the flu outweighs any complications, and that's true for every medication.
Okay. Anything to add there?
No, I think that's spot on and well said by Dr. Ballard.
Blake asked a question, and I'm going to mess this up, okay, so I'm going to do this. But he
Doug,
says,
you don't
Blake's
mess up.
already asked
No.
a question. Does
Yeah,
he get
but
two questions?
He's asking, what's the benefit of getting the
Pneumococcal.
pneumococcal vaccine in addition to the flu vaccine?
Pneumococcal vaccine is actually
Easy for you to say.
yes, like pneumonia, pneumococcal.
Yeah.
Okay, is a different vaccine. It's a bacterial illness. So, just how if you get a cold or you get the flu, antibiotics will not help you. It does not treat your condition. If you get a respiratory condition that's because of a virus, antibiotics will not work. Just the same way, a flu vaccine will not prevent you from getting a bacterial pneumonia, and the pneumococcal vaccine will help prevent you from getting pneumonia caused from the particular bacteria that virus, vaccine helps protect against.
Okay. Spring break's coming up pretty soon, at least for colleges, about a month and a half away. For K through 12, you're looking at the first week of April. And Linda has a question about, are you safe on a plane? Talk about, traveling on a flight to another location, because not naturally, this is not just a Kentucky flu epidemic, as you mentioned.
In general, flight is safe. Traveling in close proximity to other people is safe. Taking a bus is safe. But you want to maintain routine precautions. Now, if you are sick, you might want to avoid traveling so you don't infect other passengers. But in general, most people just should take routine precautions.
Just remember the same things. Wash your hands frequently. Cover your mouth if you're coughing.
We've talked about some of those who are at risk or at higher risk of the flu, but just I'm not sure that we've kind of gone over that. Who is at high risk? Who is at higher risk of the flu?
So,
Go ahead.
okay. People are at high risk if they have chronic health conditions. That could be anything from diabetes to asthma to heart disease, anything that causes your body to expend energy because of your condition or weaken your immune system. So we know that for the pediatric populations, asthma is a risk factor.
Absolutely.
And for the elderly or the older population, really any chronic health condition that makes you more at risk is included. Do you have anything
So
else?
in general, it's older individuals, so people older than 65 and children younger than 5, especially the population less than 2 years of age. Chronic medical conditions in the older, especially chronic lung diseases, chronic kidney diseases, put people at particular risk.
Okay, all right. Let's kind of start wrapping up with what's the bottom line.
Okay.
And let's kind of talk about where we are and what you want to make sure that people leave this this viewing with.
Of course. You want to take a shot? Go ahead.
Sure. I mean, the bottom line message is that flu is widespread across the state and country. There are measures that we can do ourselves to protect ourselves and our loved ones. Those measures include vaccination. That's our first recommendation to strongly get. It will help protect you and your loved ones from getting the flu and spreading it. As well, wash your hands, cover your mouth, and stay home if you're sick. I think that's the primary message.
I think that is the primary message. Get the vaccine at this point. We still strongly recommend that. There's plenty of vaccine available. Folks can go to their local health department. They can go to their primary care providers. They can, many pharmacists vaccinate in this state. And many small clinics, even little clinics, I think, within Kroger, vaccinate. So I recommend folks to get this flu vaccine this year. It not only protects yourself, but it protects your loved ones as well.
Okay. What have we not talked about, gentlemen? Because, again, you're the subject matter experts. When we started, we wanted to talk about, issues where you can protect yourself and your family, what to do if you think you have the flu or someone you know has the flu, and then get to some of the questions. And we've talked about a variety of those discussion points that really came about from the Facebook post from earlier, some about the effectiveness and the safety of the virus, of the vaccine, I should say, and then some of the other points that we've talked about as well.
Dr. Ballard, the one thing we didn't really talk about is that we alluded to how hard it is to differentiate between the common cold and the flu. At what point, if somebody's at home and they're feeling like, man, I'm not feeling well, I think I'm getting sick, at what point should that person see you, their primary care physician, or their primary care provider?
If that question is actually triggering in your brain, that might be the point. So symptoms of a common cold are the runny nose, coughing, congestion, that fullness to the ears kind of feeling. But, when you start, what's different about that typically than the flu? Muscle aches are not that common among the common cold. Fever for a long time period is not that common for common cold. those things, start triggering you to think it's a flu. If you've been around people, though, who have been diagnosed, confirmed flu cases, and then you start to develop those symptoms, that makes me think that it's much more likely that you have the flu. So that would be an indication to talk to your healthcare provider as well.
Exactly. These symptoms, Doug, are usually much more severe than a common cold. Most of us will experience the common cold once every other year or so. If you have very severe symptoms, severe muscle aches, severe headaches that won't go away, high fevers, you ought to seek care.
Okay. Looks like one more to end. This is maybe a good one to end on. We'll
Okay.
see. It's from Jen Evely. What's your recommendation for how long people can transmit the virus to others? I've seen people say 24 hours after a fever, but then I've seen the virus can still be shared to the public, family, and friends for up to 7 days from when they were first starting with their sickness. So is there a good answer to that question? Good question.
The Center for Disease Control gives guidance and recommendation, and that type person actually must know that pretty well, because there is evidence that 24 hours past a fever being gone is time that the spread of flu is much less. Now, yes, there are cases where the flu can be spread much longer than that, up to the week or so, but that is the recommendation. Exclude yourself from school, work, if you have, for at least 24 hours after that fever.
And we did have a question. I apologize. There was a question that came in earlier. A lady, a mother who said that she did not get the flu shots for her 5 and 12-year-olds, and they go to a small private school. And so if she gets them now, would that actually be worse for them if they get the flu before their immune system, before the 2-week period?
No.
What would that?
No, they should still be vaccinated. It will not be worse for them should they contract the flu.
The flu season expects to go through middle of May. It'll take about 2 weeks for those children to get fully their immunity to fully build up against the flu. But there's lots of time between now and May that those children are going to benefit from the protection of that vaccine.
And let me reemphasize a point I made earlier. If this flu season mimics flu seasons from the past, we expect the vaccine to be more effective against later versions of the flu. So they would still have added protection if they got the vaccine now.
We typically see type B flu towards the end of the season, so that vaccine will help protect them from that.
Exactly.
Okay. And we're at about 30% effectiveness at this point? Is that
It's
high 30s.
It's preliminary data from the CDC. They're going to officially show their preliminary data in mid-February is what they tell us. They say it's about the same as last year, which was 39% effective. So you have a greater than 1 out of 3 chance of protecting yourself from the flu with the vaccine. So that's a very a good way to protect yourself from the flu.
Okay. And this question from Andrew Colgrove: how many people who died in Kentucky from the flu got the flu shot? I don't think we have those numbers yet. That is an excellent question, something that we actually talked about before this program began and talked about earlier today, as a matter of fact.
So in general, when there's anybody that dies of any illness, there's a look back at what was the contributing factors to their death. And that has happened for the 65 people in Kentucky who's passed away. Many of those people have been unvaccinated. Some have been vaccinated. The biggest group that we have is actually we don't know what their vaccination status was, because if a person went out to one location, to a pharmacy or here or there to get their vaccine, that record may not be readily available to the coroner or medical examiner to tell us whether they were vaccinated
So
or
it
not.
may be a while before you actually get the data,
Right.
if you can get the data. In all
If we
situations.
can, because
We're always fighting the battle of getting good data
Yeah.
in public health.
Okay. Well, gentlemen, I appreciate your time this evening, Dr. Howard and Dr. Ballard from our Department for Public Health, and we really appreciate you joining us for this Facebook Live event tonight talking about the flu. There were a lot of questions, or some at least. I was trying to scroll through here and didn't get to all of them. I apologize if I didn't get to your question. We will go over and we'll have Dr. Ballard and Dr. Howard, later tonight. Before they go to bed, they can go back and reply to all these questions if you want. But we will try to get someone from DPH to get back with you again, because if you have questions and actual concerns that need to be addressed, then we'll try to get back with you on their Facebook post. We appreciate you joining us this evening, and we will continue to reach out in platforms like this when there is a need, and we feel there's a need in this situation to get information to the public and have some interactive dialogue. So thank you very much for your time. Have a good night.
Thank you.